when he's ready.
Is this what you used to do?
This is what I'm good at. I was trained in this.
Marty, I'm going to bring you over just a little bit.
With Art Norman and
Where'd you go? You went to DePaul too?
no, I went to Columbia.
Columbia.
College.
Oh, yeah.
First, I started off at Wheaton,
Oh, yeah.
and then I wanted to.
Yeah.
I figured out that I really wanted to do this area, so I went to transfer to Columbia.
Straight into a little bit.
It's good though.
This way?
You learn how to write everything from corporate style writing to newspapers to commercials, interviewing. You just learn a lot.
From Columbia, that's the famous one, right?
The one downtown.
Downtown.
Mhm. All my teachers were from either Channel 5, the Tribune, Sun-Times.
I'm rolling.
Ready? Hello, Isabella.
Hello, Miss Marnie. Look at you, right?
Yeah.
Yeah.
So just please tell me your name and your title.
George N. Miller Jr. I am president and CEO of the Loretto Hospital.
So how long have you been the president and CEO of the Loretto Hospital?
This is my 20th month. I used to count in days, but now that it is gone from 1 year past, we're now counting months, and I'm looking forward to counting the years.
So talk about your first year. What was it like here when you first arrived?
It was one of excitement and thrill to take a helm of a safety net hospital on the west side of Chicago, something I read and heard about most of my career, particularly because healthcare in Chicago is so dynamic, it is very competitive, but the inequities in healthcare was a stark difference for me. One of the things that I learned very early, and I'm bound and determined that we're going to change that, is that if you live downtown Chicago, life expectancy there is 88 years of life, but you come just 9 miles away, a 20-minute ride on the Eisenhower to exit 23B, and it drops to 68.2 years of life. And that struck a nerve that in 20 minutes you lose 20 years of life. And then I learned about the other inequities in healthcare and how you work to forge the narrative to be different for this community and for the patients we're privileged to serve is something I'm very excited about. And if you ever want to leave a mark, this is a way we could do it here together as a team at the Loretto Hospital, to speak for the voiceless, to defend those who have no defense and they need someone else to step in their place and articulate their need, their wants and their desires. And we should leave this community healthier than what we found it. And that's why I'm very excited about being here.
So this is a question I've always wanted to ask you. When you first came here, you found out you were the first African American CEO. For a lot of team members, it meant nothing. But for me, I saw something different. What did it mean for you coming in as the first African American CEO?
Well, one of the things in my career, I've been the first African American CEO at a lot of places, but they were majority communities. I remember going in Jasper, Texas, Fort Stockton, where I teased that the demographics in Fort Stockton was 65% Hispanic, Latino, 35% white, and then it was me, my wife, and daughter. So that was an interesting complex, but to come here to the Loretto Hospital, where we serve primarily an African American community for the last at least 30, 40 years, and then to be the first CEO was a great honor. And with that great honor is great responsibility. It'll mean nothing if we don't change the narrative of healthcare that are served here in the community, and we not make this community better, then it'll be all for naught. Got to step up to the plate, and I'm even more enthusiastic about the opportunity with other fellow CEOs. If you look around our leadership team and the diversity of women and other ethnic minorities from around the world on our senior leadership team, is very exciting to lead that team.
So what was your greatest challenge coming through the door?
Yeah, the greatest challenge, there are two great challenges. One is our financial situation. We take care of 75% of our patients on Medicaid, which is the worst payer in the country for Medicaid. So that means our resources, our finances were a great struggle. And also changing the culture here, that we had to believe that we're at the right place at the right time to make a difference, to make the changes that is necessary for us to not only to survive, but thrive. And that change was very important to help orchestrate and lead. We have some great team members here, but we had to have a clarion call to our mission and our values. So I was very excited to do that as well.
So when you talk about health disparities, that is such a broad issue that it's nothing that we can tackle as one organization. So what is your plan moving forward to help mitigate this problem in the communities that we serve here?
Yeah, one of the things is to partner, and we have great partners. In fact, this past year we celebrated with our partners that we can't do this work alone, but there are great partners out in the community like Mount Sinai, Norwegian American, Malcolm X College, Affinity Health that helps us
Tanisha
do.
Daniels, please call the operator. Tanisha Daniels, please call the operator.
To help us do medical research. We're the first and only safety net hospital in the state of Illinois to do FDA-approved clinical trials to improve the health of those who are trying new drugs and regimen to improve their health. So we're very excited about the partnerships we foster with many organizations.
Do you mind saying that again? Because we got interrupted.
Yeah.
With the Mount Sinai.
Sure. Some of our partners include Mount Sinai, Norwegian American, the Safety Net Hospital Association, the IHA, Affinity Health that helped us be the first safety net hospital in the state of Illinois to do FDA-approved clinical trials. And the research that comes behind that will benefit our community. And that's something we're very excited about. And quite frankly, thankful that we have great partners in this community to do this work together. UIC is another one where we do with Dr. Wynn and oncology, that we're able to partner with a great institution like UIC and see patients here, refer them to UIC, and then bring those patients back here for this community to be served through infusion therapy.
So we're going to talk about our transformation, because that's your big thing. And so you talk about it a lot. And what does that mean? What exactly does that mean? It's not just dollars, but it's everything.
Right. Well, if you look at the word, what it means to move. If you look at an electrical component, when you have high voltage, you need to step it down, you use a transformer. When you have low voltage, you need to step it up, use a transformer. So we had to transform this community, ourselves, and the way healthcare is done for our community, where we go and ask questions, involve them, and help educate our community and our patients so they can get the knowledge to do things differently. Many diseases that we face are lifestyle diseases, and we need to transform the minds of our people, transform our leadership team and how we address how healthcare is done in this country. 5 years from now, we will transform healthcare and do it completely different. We'll use technology, artificial intelligence to make decisions. Even our smartphones now that we have, when I first started a career, doctors used to have a big book and how they look things up. Now, in just a little handheld iPhone, you can get all that information there. And so they have it at their fingertips versus going to do a lot of research in a library, a medical library. Now we have it at our fingertips. So healthcare is going to be transformed. We're going to do much more outpatient, inpatient. We're going to have to do more outreach into the community, go where the patient is and deliver care where they are versus having them come to a building.
So do you think, before I even get to the MCOs, do you think the MCOs is sort of kind of driving us to transform and moving us faster than we normally would?
Well, one of the things that I think that MCOs now recognize that they have to transform as well. So they will be our partners going forward. We're sometimes a challenge, and they are a challenge because of the low reimbursement here in Illinois. But if we look at ways that we can prevent people from being hospitalized, you'll save a lot more dollars instead of the episodic care when they get sick. So we should do more of a partnership with the MCOs to create new models of healthcare where we're paid to keep the patients well. And we go out and partner with community organizations who have that same desire to give information, education, and keep people well and do more prevention, diagnostic, imaging, and prevention. The earlier we can detect a chronic disease, the better. And we can, quite frankly, avoid some chronic diseases like diabetes. As you know, that here we're very fortunate to have a young lady named Nancy Rodriguez that helps to reverse diabetes. Those are the types of things that we can do and be at the forefront of changing with the MCOs, the payers in this community.
So when we talk about the whole transformation process, that also entails taking a deep dive into our operations to kind of revamp that. What are some of the key ways we have revamped here to transform this hospital? Yeah,
well, one of the things that we've done is bring other services we did not provide here and partner with other organizations and investors to bring those services here. Again, as I mentioned a little earlier, we're going to go to more of an outpatient model, taking care where it is needed, and also bringing services here like infusion therapy and partnering with UIC. That's part of that transformation. It used to be when I first started in healthcare, we built beautiful buildings and put a sign outside and people would come to the building. Now we've got to go out to community where they are. For example, in Austin, it's a food desert. So we have to not only talk about health, but food, transportation, nutrition, housing. All of those are elements of a healthy lifestyle. So you have to have all those together. We just can't sit here and wait for people to get sick and come in the building. We've got to go out and try to help them transform the community as well as transform what we're doing here at the Loretta Hospital.
So our quality, you can't transform without elevating quality and safety. So share just what high quality of care for Loretto Hospital looks like.
Well, that's an excellent question, and that's the first thing we talk about doing, putting the patient at the center of everything we do. And you elevate quality by having high quality people and services, but equally important, you engage and ask questions of the patients and their families so they understand. They have to participate and they have to hold us accountable. For example, we have signs that say, ask your provider if they wash their hands when they come in the door. Washing the hands is still the CDC says, is one of the best way to prevent spreading of diseases. So we want our patients to hold us accountable for having high quality standards. That's one example of how we do that. But what it also means that we'll be able to attract more businesses by having high quality health care, that we meet the high standards that for us as HFAB is our accreditation body, we meet those high standards. Other agencies like IDPH can come anytime unannounced, and we're always welcoming them in to evaluate our quality and our processes to better serve our patients.
What are some of the quality programs that we have here?
Well, there are many, but the quality.
Just do like the high level, because you'll lead into Olu saying,
Yeah.
you know.
Yeah.
So just like huddle,
Right.
Just name some of that.
Well, there are several things that we do here to promote quality. One is we do a safety huddle. That is all the team members at 8:30 in the morning. We huddle around administration and we go through and see if there's any challenges that happened the day before. So all of us are knowledgeable. All of us can participate and hear things that we need to improve, whether it is appropriate staffing, if we have the right equipment, if something is down. You know, we have 6,000 different pieces of equipment that we take care of our patients, and sometimes they go down, and we need to know that. If a room is out of service, if there's a supply issue, the whole gamut we talk about openly and freely, and even if there's a challenge with patients, what is happening, what we need to do to address that. Last week we had a code black, which means that we were concerned about the conditions for a tornado happen, and we had to be prepared for that. So that's one thing that we do. We also do surveillance. We have a quality quality team, we have an infection control team, we have an infection control nurse that monitors our patients for infections and for wounds, and we make sure we take care of them. We also have a leadership that does rounds to make sure that we meet all the standards of HFAB and IDPH on a regular basis, and we our own mini survey team inside the hospital to make sure we do things correctly. We then report to our MIC quality team each month to make sure we're meeting the high standards that both the CDC and other national agencies meet for the care of the patients. So review data and statistics to make sure that we're meeting the high standard of care as set by the Joint Commission, HFAB, the CDC, HRSA, and the other multitude of federal agencies that we have to comply with.
So now I really want to talk about the MCOs just briefly. So you already know this question. What is the issue? I mean, it's created so many economic hardships for safety net hospitals, including Loretto. So what is the issue and how has it impacted us?
The major part of the issue is that we had a multitude of MCOs. Last year it was 14. Now it is 7, and they had 7 different ways to pay us. So we had to learn 7 different ways. It was not uniformity. And then they would take, on average, until we recently started meeting with them, 154 days to pay us. And then 1 out of 4 of all of our claims that we submitted them to be paid were denied for a multitude of reasons, some of them that were not consistent with giving good health care. I know I had a discussion with one of the MCOs and said, but we took care of your patient. We got them well. And they told me, well, you didn't put the claim in the right format, so we had to kick it back. Or we hired a new ER physician. They had been seeing patients, but they had not credentialed them on their system, their MCO, and they denied all the payments we saw of the patients. Although we had turned it in timely, they still hadn't recognized that position, and they denied all those payments. And the list can go on and on. We're working better together, and the system is working better, but we had to complain very loudly. And the MCO problem was just not only here at the Loretto Hospital, but the old saying that when larger hospitals have a cough or sniffles, we have pneumonia. So we had to be very, very active and proactive about it. And it has changed. But until this last round of meetings with our legislators, and we are very thankful to Senator Kim Leifert, to Representative Camille Lilly, and Representative LaShawn Ford for advocating very strongly that safety net hospitals cannot be treated like other hospitals, because the majority of our business, by definition, is more than 50% state Medicaid, which again is the lowest payer. They don't pay as much as Blue Cross Blue Shield, commercial insurance, or even Medicare. And thus it created the financial hardship we found ourselves when I first walked in the door.
Do you think your background with MedPAC really gave you an edge on dealing with the issues with the Medicaid issue here?
It did. MedPAC, and thank you for asking that question, stands for the Medicare Payment Advisory Commission, which is a federal agency created by Congress and President Clinton with the Balanced Budget Act of 1997. There are 17 commissioners appointed for me, it was President Bush, and reappointed by President Obama. And we study healthcare in the aggregate across the nation. How do we bend the cost curve, the fast growing of the Medicare program, to make sure it's available for your children and your children's children? And it gave me a perspective to see healthcare, not just at my hospitals that I've run, but the broad spectrum of healthcare and the changes in healthcare. Technology is advancing so quickly, and some of the MCOs have not kept up with the changing face of healthcare. And particularly for us who serve the poor and vulnerable populations, they didn't recognize the inequity and disparities in healthcare, especially for poor, both brown, black, and poor whites, quite frankly, across the nation. And MedPAC let me see data about where problems have happened because we didn't have appropriate reimbursement for providers and especially in rural communities and inner city communities like Loretto. The inequity in healthcare was just stark, and it made me realize we got to do things differently and do things better. And so that's why the passion about changing the culture, the passion about getting appropriate reimbursement for the least of these, our citizens, especially those who are poor, vulnerable, and homeless. There's a large homeless population that have no resources whatsoever. And some of their homeless is not just health care, but it is housing, it is transportation, it is a food desert, and those other social determinants of health make a huge difference in how we have to deal with health care now and in the future. It can't be like it was in the past. You've heard many of the statistics, some of the foods we eat or don't eat contribute to the health. The obesity crisis in this country is unparalleled, and much of it is because of the types of foods that we eat now and the lack of exercise. We don't get out and play. When I grew up, we left home, we didn't have pagers, let alone a cell phone. We had to be home by the time the street lights came on. But we got outside and took active part in playing in ball games and running in the park and swimming and hiking and biking and doing all those great things. We don't do that as much now. And as a result, we have what we have, and we've got to change that.
You mentioned housing. We have a program here. You know a little bit about that?
Yeah, we have a program that we partner with lawyers to help fight problems that could cause healthcare problems like roaches, infestation, moles, lead paint, and we can refer our patients to the lawyers legal defense fund. That's not the correct name, but
No,
we need to get.
I can chop it up. I just
Yeah.
wanted you to tee it up. So
Yeah.
You said what I wanted you to say.
Yeah,
And
yeah.
there's just a couple more.
Sure.
So, despite our financial issues, and you're going to tee it up for Anash, we are still moving, and we're doing some amazing things. And that includes expansion and new services. Can you just kind of briefly talk about your vision for expanding healthcare for Loretto and some of the new services that we have?
Right. Well, one of the vision about expanding, again, as I mentioned earlier, the mantra of building a building and everybody coming to that building has to change, and we've got to get out in the community and provide services that the community needs. And part of that is we do a community health needs assessment each year, and to find out from the community that we serve what their issues are, and then try then to address them. So the couple of things that we found out is we used to have an MRI truck come once a week, and we now have it 3 to 4 days a week. We have a permanent. We got permanently invested in an MRI, and it's now available more. We've bought 2 doctor's offices and spreading our message out to the doctor's office and expanding beyond the 4 walls of the hospital. We have an infusion therapy company coming in now that do fusion in therapy. Unfortunately, cancer ravaging our community, and doing infusion therapy with the partnership with UIC will be fantastic for us. We're putting in fact, we filed the certificate of need for end-stage renal disease. We'll have that here. There are 24 end-stage renal dialysis centers in the Chicagoland area, none in Austin. 0 in Austin, so we're going to put one here by the end of this year. End-stage renal disease is very, very important. This amazing statistic is 40% of all patients in America with end-stage renal disease are African American. Yet we only make up 11.4% of the U.S. population, yet 40% are on end-stage renal disease. And the only cure for that is a kidney transplant. An amazing statistic to me, because the average person on end-stage renal disease lives about 7 years. So the only cure is a kidney transplant. Yet we African Americans only get 2% of the kidneys transplanted in America, which is a great inequity. So we have to provide more services and get folks well. And the best thing to get them well is to keep them from ever getting diabetes and then ending up with end-stage renal disease. So that's part of the vision, to help transform by attacking diseases that plague the community and try to address them and try to prevent them from ever happening by education and information, more outreach. We partner with an organization called I Am Able. That we partner with Northwestern. We did a community grand rounds. We bought the great teachers and professors from Northwestern University combined with the I Am Able Foundation, did community rounds where we talked about cardiology, diabetes, food programs, cooking and eating correctly, women's health issues, breast cancer, cervical cancer, and the like. And it was an outstanding event, and we'll be doing it more in the future, reaching out to the community and tell them the services we provide here.
If you had to say, just send a message to the community about Loretto Hospital, what would you say?
We are your community hospital. We're here for you. We're here to advocate for you, to provide health care for you and provide health for you as well. There's a difference between healthcare and health, and our goal is to make our community healthy. We want everyone here to live 88.2 years of life, just like downtown Chicago. They deserve that, and that's why we are here.
Thank you.
Yeah.
I got
One
two
question.
questions.
Okay, go ahead.
First question is.
Look at her.
Yes, please.
Okay.
Okay. So you got
Your mouth is not moving while he's asking questions.
I'll pretend.
Go ahead. I'm sorry.
So you're talking about how the life expectancy downtown is higher.
Mhm.
Well, now you have also partnered with surrounding communities that are west and southwest, being Oak Park and Berwyn. Am I correct?
Correct.
Can you just touch on that a little bit? How, like, even the western suburbs are now helping out in this whole transformation.
Sure. One of the reasons why we went outside the four walls is because our community, we draw patients from all over the communities, some in Berwyn, some in Oak Park, East Garfield Park, Lawndale, and those communities. So we wanted to put our footprint there. So we expanded to clinics there to take our message about improving the health in that community. So we thought it was important to reach out. We'll do more as our resources allow us to reach out in the community so people don't have to travel here. One of the things I think is important to mention, though, we do provide free transportation for our patients. And we realize that as an issue. One of our patients recently talked about that she would not be able to get health care if we didn't come and pick her up and take her back home. And that's one of the things that we found. Transportation is a major social determinant of health, and we've solved that a little bit by providing from 7 to 4:30 free transportation for any of our patients as long as they lived in our service area. And we go as far as down south as on 95th Street.
Okay, if you were to sum it up, when you first came to the Loretto Hospital, what was your goal? Just summing it up.
Yeah, and my goal was to help our community be healthy. There's one thing to give health care, but the goal is to make people healthy, to educate them, for them to understand that they have control of their health care future if we give them the right information, if we communicate with them, if we give them the right tools that they can make decisions for themselves.
Good
All right.
job.
Thank you.
Next.